Okay, good morning and welcome to our presentation this morning. Our speaker today is Dr. Magriet du Plooy. Dr. du Plooy is a highly respected pediatrician. She's got over 25 years of clinical experience. She earned her MBChB from the University of Pretoria in 1995 and then specialized in pediatrics, obtaining her FC Paed and MMed in pediatrics. She further enhanced her expertise with a diploma in child health and certification from the Medical Council of Canada. In 2004, Dr. du Plooy relocated to Canada, where she practiced as a consultant pediatrician at East Kootenay Regional Hospital and later at Magriet Regional Hospital in Alberta. During her 18-year tenure in Canada, she developed a special interest in neurodevelopmental and gastrointestinal disorders, deepening her understanding of the intricate connection between gut health and overall well-being. She returned to South Africa permanently in November of 2021 and currently practices at Mediclinic Midstream Hospital. Recognizing the critical role of gut health in disease prevention and management, Dr. du Plooy founded CureHealth in April 2024. CureHealth offers an integrative, science-based approach to optimizing patient health through a multidisciplinary program led by a physician, functional dietitian, and psychologist. Dr. du Plooy has been recognized for academic excellence, receiving the Council of Psychiatrists of South Africa Medal in 1995 for being the top final year medical student in psychiatry, as well as the Rowan Pulak Rohrer Prize for outstanding achievement in psychiatry in 1993 to 1995. Her commitment to excellence continues to drive innovation in patient-centered care, bridging traditional medicine with functional health solutions. So she will be speaking about the link between gut health, immunity, and chronic diseases.
Thank you, Leanne, for that introduction, and thank you, Emmanuel, for the invitation to present on your platform. It's really my pleasure to be here. I'm very passionate about gut health, and if I have an opportunity to talk about it, then I definitely will take that opportunity. Just again, credentials, that's me. Okay, so I'm going to start with Roseanne. She's a completely fictional 57-year-old female. You should perhaps imagine her maybe a little bit heavier and a little bit sadder, because then she'll fit all her health concerns. So she's got a few things going on. She's got hypothyroidism post Hashimoto's. She's got a very, very long, so for that she's on alprazolam. She's got a long-standing history of insomnia and has been on Zopiclone for years now with varying results. She's got this non-specific dermatitis that will just flare up every now and then. She's seen a few dermatologists. No one can really pinpoint what it is. It's not psoriasis. It's not eczema. She gets marginal response to topical steroids, but really it's quite bothersome. And then probably the last 2-3 years, she's been dealing with some anxiety, just like a low mood, brain fog. Family physician started her on Lexinol, some improvement, but yeah, she's still not feeling quite herself. Hypertension, she's been on enalapril for a while now. Quite concerning to her is that she's been gaining weight. She's convinced that she's not eating more, she's not exercising less, and she's definitely finding that around her abdomen, what we would refer to as visceral fat. Like, she's definitely having some issues there. And then for the past few years, she's had some like fluctuating IBS, predominant constipation concerns, and then these food intolerances. So this is my hypothesis, my theory is that what if two pathophysiological processes, namely increased intestinal permeability and mitochondrial dysfunction, could explain most, if not all, of our presentations? So that's kind of what we're going to focus on. So just to clarify, this is a pretty comprehensive presentation. I'm not going to verbatim repeat everything. Anyone that's interested in getting the presentation can just contact me, and we'll just email it. But we're going to talk about increased intestinal permeability first. I mean, most of us recognize the function of the GI tract. So obviously we need to keep the bad stuff out and absorb the stuff that we need for all our processes. So very, very important to understand is the intestinal barrier has two layers. The one is what we call a apical barrier, and the other one is a basolateral barrier. I'm going to quickly go to the next slide, so just to show you. So we have that here. So we have our apical side, which is towards the lumen, and then we have the basolateral side, which is towards the bloodstream. Then we have this, and this is a complete healthy gut. So in non-disease state, we have different ways of transporting what we need from the apical side to the basolateral side. We have facilitated diffusion, paracellular transport, ATP binding cassette transporters, and then diffusion. There. Yeah, so in any case, so that's kind of what we refer to. So then obviously the interaction of these barriers allow then the maintenance or the maintenance of these barriers help us then with intestinal homeostasis. So the idea is just to keep the commensal microorganisms, pathogens, nutrients, and inflammatory particles to discriminate which should stay in the luminal side and which should be absorbed. So obviously we have homeostasis under normal situations. So if there's a lack of intestinal integrity, then this could then now trigger disease or inflammation. So everyone has heard of the term being thrown around, leaky gut syndrome. A long time ago, when I heard patients talk about it, I was kind of skeptical until I started understanding that, it's referring to the state of increased intestinal permeability. So obviously, it can cause intestinal disorders, which would be IBD, IBS, alcoholic liver disease, non-alcoholic fatty liver disease, steatohepatitis, cirrhosis, and collagen diseases. But the really, I think, important thing is to recognize that this increased intestinal permeability is not just causing intestinal disease, but it's causing widespread systemic disease, affecting the pancreas, the heart, the lungs, the kidneys, brain, a few more as well. We'll briefly touch on those as well. So I'm not going to go into detail on this slide, just basically referring to intestinal and non-intestinal diseases that gets affected by this increased intestinal permeability disease set. So again, this then results in harmful microorganism toxins, undigested food particles then that will come through the tight junctions that's supposed to maintain the integrity of the intestinal epithelium, and then it reaches the bloodstream. So obviously that has widespread results. We can get hormonal, immune, nervous, respiratory, and reproductive systems all get affected by this. Again, I quite often explain to parents that I counsel, we talk about epigenetics. So it's where we have the genetic predisposition, where then certain environmental factors then trigger these alterations in the immune responses. So where we should have tolerance towards these commensal intestinal microbiota, then we lose it. And then that results in our tissue damage and our chronic inflammation. I have a few slides on diet. That's obviously one of our biggest concerns at this point is what the population is being exposed to. But obviously a typical Western diet, high in sucrose, carbohydrates, polyunsaturated fatty acids, and high omega-6 fatty acids, low fiber will all be risk factors for us to develop a disease state. Okay, so I'm going to quickly go to this slide. Honestly, I teach my parents this. I teach them that this is how your intestinal layer looks like, and this is why everything is happening in their bodies and their kids' bodies, and then they understand my approach to turning this around. So we have 4 layers. we have the gut microbiota. We then have what we call a chemical barrier. We have a mucin barrier, and then we have the chemical is the mucin barrier. Then we have the epithelial cells, and then we have this immune barrier. So if we look at the different components, we have obviously the microbiota, the chemical barrier, the IgAs, AMPs, antibacterial peptides. To physical barriers, then our intestinal cells. So we have goblet cells, Paneth cells, and then our stem cells. And then very important to today's discussion is our immune barrier, which we have our T cells, B cells, macrophages, dendritic cells, and then mast cells that seem to cause most of the trouble that we deal with. So the core principle is that 70 to 80% of our immune cells are located in our guts. So if we have any disease state that results in this chronic low-grade inflammation, then that will spill over to the rest of our body. Okay, so now we're going to talk about another principle, and that's what we refer to as the tight junctions. So if you remember the slide we did about the paracellular transport, in a healthy state, then you'll remember that we have these tight junctions that closely adhere the epithelial cells together, and then they prevent what we refer to or previously talked about, the toxins, the bacterial breakdown products, food particles from reaching our bloodstream. So again, most important is that the tight junctions are then critical in maintaining the integrity of the normal barrier. Just to mention that the tight junction proteins must be then regulated to avoid any deleterious effect on this integrity. Again, we refer back to what we call the leaky gut syndrome. So this is probably the easiest slide to remember. We have all these bad stuff that we want to stay outside, and then we, in a non-disease state, will have no entry to bacterial particles, toxins, undigested food particles. In disease state, everything leaks, and then we have this chronic low-grade immune stimulation, which again I referred to as a hyperstimulation. These two next slides I've added for anyone who is having trouble sleeping at 3 a.m. and really want to review their immunological cascade and just look at the anatomy, this one as well, just the interplay of our immune system, what happens in a disease state where we have this chronic low-grade stimulation. Okay, so then let's quickly touch on the gut microbiome. So it's quite amazing when you look at the numbers. We're looking at 100 trillion bacteria, biomass of 1.5 kgs. In a healthy state, we have more than 200 microbial strains. To me, quite fascinating, and I think this is where a lot of focus these days on disease prevention is going to be, is that the human genome has 20 to 25,000 protein coding genes, while if you look at the bacterial community, we're looking at 9 million genes capable of providing characteristics that the human genome does not possess. So if we look at the composition, it's mainly bacteria, but remember, we also have viruses, fungi, and protozoa. Okay, then we have the role of the microbiota is stimulation of the immune system in a healthy manner, maintenance and repair of the gastrointestinal mucosa, then degradation of dietary fibers. This is very important. Increase in function, motility of the GI tract, and then the facilitation of absorption of nutrients and inhibition of pathogens. I think very important for you guys to recognize is that this protein degradation and reduction in sulfur compounds generates hydrogen sulfide, which has an antihypertensive effect. And then this seems to overlap with the nitric oxide and prostaglandins, which cause then anti-inflammatory and antihypertensive effects. There's a lot of talk about these short chain fatty acids and all the positive health benefits they have. And then it produces other beneficial metabolites, polyamines, and then vitamins B and K. Okay, so if everything is in homeostasis, then the gut microbiome lives in complete homeostasis with our bodies, and it's a healthy interplay for both of us. The term dysbiosis comes in if there's a breakdown in this homeostasis, and then we have the possibility of developing a disease state. So I'm just going to quickly refer to the health conditions that could be associated with increased intestinal permeability. So we have metabolic and autoimmune systemic diseases. We have obesity, non-alcoholic fatty liver disease, neurodegenerative diseases, cardiovascular conditions, IBD, and then even type 1 diabetes. Again, I'm not going to talk in detail. This is quite a crazy slide, but it just reminds us of how interconnected everything is and how the gut seems to be at the center of a lot of our disease processes. Again, I'm not going to talk too much detail. These slides are more a reference. We have IBD, but just to see that they seem to have a higher intestinal permeability, and then a breakdown of the tight junctions. And then IBS, I think, is really important to recognize. I think for years, and even, some people still feel or presented to patients that if you have IBS type symptoms, it's all in your head, stress. But if you look at the evidence of chronic low-grade inflammation, there's definitely cytokines that's increased, which elevated levels of the tumor necrosis factor, interleukins, and 1B and 6. They're just going to refer to this protein zonular occludens, and the occludin in intestinal tissue seem to have lower levels. So there are some experts that recommend doing serum zonulin levels with increased levels, then predicting the disease state. Obesity, most of the models that we have linking obesity to gut health has been mouse models. So two ones that stand out would be obese mouse models, which looked at or demonstrated increased intestinal permeability, and then some pro-inflammatory cytokines present in these mice. And then, so that was compared to the wild type mice. And then we have the obesity induced by high-fat diet, like a typical Western diet, that then linked, that in mouse models, again, that was being linked to the changes in the population of the intestinal bacteria. So there is more and more evidence that obesity is not just willpower and eating too many Twinkies, but literally that there could be some changes to the intestinal microbiota resulting in those changes. Again, I'm not going to talk in too much detail. These reflect intestinal diseases, again, with evidence that we have low-grade inflammation as the basis. Very important is this plasma lipoprotein saccharide. This seems to be a driver of a lot of the chronic health diseases that you guys might also be encountering, hypertension, cardiovascular disease. So that's literally particles of the bacteria that leaks into the blood, LPS, and causes this low-grade inflammatory changes. I think we can literally have one full discussion just on the effect of LPS. Again, chronic heart disease, I'm not going to talk too much. It's just quite interesting to recognize that people with patients with chronic heart failure, a 35% increase in small bowel permeability with the lactulose mannitol test, and a 210% increase in large bowel permeability with the sucralose test. Again, evidence of all the inflammatory processes going on, cytokines being elevated. Celiac disease, again, it's probably the easiest one to understand. Gliadin causes this chronic inflammatory response, and then this causes then alteration, structural alteration to these tight junctions. Okay, so very interesting to me. I mean, we all know about type 2 diabetes, but the very real correlation between type 1 diabetes and increased intestinal permeability. Again, showing that link between the impaired intestinal barrier function, and very interesting to me, and maybe that would be helpful for health, prevention in future, where they showed increased intestinal permeability before the onset of symptoms of type 1. So I think for genetically predisposed individuals, that might really bring some hope in future. Okay, so dysbiosis we talked a little bit about. I'm going to refer back to this bacterial lipopolysaccharides. They seem to be an integral part in the disease process that we deal with. And then dysbiosis also then causes the stimulation of mucosa-associated lymphatic tissue within activation of the inflammatory cascade, and that results then in massive tissue damage. Infections, I'm just going to mention H. pylori, which we all know, again, increased intestinal permeability, and again, due to the redistribution of the zonulin protein from the tight junctions. Again, no need to talk about antibiotics and then different drugs. We have our NSAIDs, aspirin, paracetamol. These are just a few. There's some evidence that hormonal replacement, like a lot of the common prescription medications, seem to have a effect on our intestinal permeability as well. Again, I'm not going to go into detail about alcohol, but it does seem to decrease the hydrophobicity of the mucosal layer, and then causing some issues with and increased permeability.
Are you
so
inside? Oh, you sneaked in. I didn't even hear you.
Cancel our
Okay. Yes, okay, that's good. Enjoy.
Okay, so we're going to talk a little bit about stress. This is a bit more complex. It's not just the gut result effect. Definitely, there's a brain effect as well. But there's definitely been shown with especially low grade, we can get acute stress, and then low grade ongoing stress seems to be affecting the permeability of the gut as well. Okay. Again, not going to go into too much detail. We talk about the Western diet. I'm going to show you the next slide, which I think is actually nice reminder of what we're doing to our bodies. We're looking at, all this oxidative stress, and then downregulation of our tight junctions, whereas something like a Mediterranean diet would cause enhanced mucus production, increased antimicrobial peptides with decreased oxidative stress and upregulated tight junctions. And then obviously this favors health and this favors disease. Just again, high-fat diet. I'm just going to mention, because when you do research, it does come up the short-chain fatty acids. We have galacto-oligosaccharides that supports, so these would be prebiotics that support the growth of the beneficial bacteria, and then dietary fiber seems to have a positive effect on intestinal permeability. Interesting, dietary fiber has not been shown to increase our immunity, whereas fermented foods have, but definitely the fiber seems to have a positive effect on the intestinal permeability. Again, we talk about the short chain fatty acids, and then just again back to our Western diet, all these food additives are definitely not gut friendly. Okay, again, just decreased permeability, increased permeability, just a reference slide. Okay, I'm not going to say too much about mitochondrial dysfunction. I just want to clarify that I'm not referring to mitochondrial disease. I'm talking about literally our obese patients with high cholesterol, insulin resistance, what's happening with their mitochondria. Just a quick mention where we have our highest energy consumption would be our brain, muscles, liver, kidneys, GI tract, heart, and lungs. And then just remember that we have a slew of other functions of the mitochondria as well. It's not just ATP production. And then definitely genetic mutations seem to play a big role if we're talking mitochondrial dysfunction, but infections, aging, lack of physical activity play a role as well. And then this then results in a mechanism that can influence various diseases. So a lot of these mitochondrial dysfunction has brain effects, Alzheimer's, Parkinson's, Huntington's, other metabolic diseases. Very important is the role in diabetes, where it seems like it's a two-way street between diabetes and obesity, with high, the insulin resistance affecting mitochondrial function, and mitochondrial function become downregulated, less active or less effective, and then resulting in more insulin resistance. So there's an emerging theory that this is kind of what I base most of my premises on, is that there's this microbiome mitochondrial axis, and then basically it's a two-way street. And just that the initial research shows that we have conditions that's linked to dysfunction between this axis, any of the intestinal inflammation disorders we talked about, colorectal cancer, degenerative diseases, and then depression, just to mention a few. And then again, it's the crosstalk between the mitochondria and the gut microbes. And then it seems that, and this will happen in any type of epithelial cell, that there's high turnover, and that's why the gut is such an important role player, because epithelial cells have that regenerative capacity. And then the idea is just to optimize the relationship between this crosstalk between mitochondria and the gut microbiome. Okay. Okay. So Leanne mentioned I started a company. It's called CureHealth. It's kind of developed a life of its own. Initially, I was really focused on gut health, but the more I do my research, if you focus on gut health, then you focus on brain health, and then we talk about, we'll definitely target the mitochondrial dysfunction we mentioned earlier. So basically what I did is I was driven by finding answers. In Canada, I was looking after a lot of patients with mast cell activation syndrome, and I became quite proficient at managing the symptoms. So, I could, with the best of them, reiterate, all the meds we have to use, but I mean, that's 5 or 6 different medications, up to 4 times a day, and it's purely symptom control. And I really started thinking about the quality of life of living with these symptoms. And then lo and behold, I developed mast cell activation myself, probably because of, just exposure to in theory, the GMO foods we're exposed to. So what I did is I went and I looked at a massive amount of research. So everything's evidence-based, is what yields the gut. And I literally looked at research, anything I could find put my hands on, to try and develop a protocol that would take us from this diseased, increased intestinal permeability state to a healthy state. And I came up with these 9 supplements, or the multivitamins, probiotics, DHA, omega-3 fatty acid. And then I came up with the idea of numbering them, because patient compliance is a massive issue. So to make it as easy as possible, and you'll see it says GBSI, so gut brain sleep immunity. and we go from 1 to 9. So I'm going to quickly scroll through the benefits of all. Again, there's lots of reference. I'll show you quickly how to navigate my website as well. So what I aim to do is I aim to empower my own patients with knowledge. So we've developed close link between my website and a YouTube channel with a lot of AI podcasts. But the idea is that people can literally go on it themselves and then increase their own knowledge and understand the theory behind using these supplements together. So again, I'm not going to go through all of that, but just at a glance, you can see vitamin C, very effective at boosting gut barrier, healthy microbiome, reduces inflammation, nutrient absorption, and then improved immunity. Quercetin is amazing. It's a natural antihistamine. It's a polyphenol, and it's honestly, in my opinion, more effective than any over-the-counter or prescription antihistamine that you could ever think to prescribe. Again, if we look, basically a lot of the functions are overlapping: gut barrier integrity, microbiome, gut inflammation, nutrient absorption, immune system, D3, K2. So again, boost calcium, magnesium absorption, strength our immune defenses, and it's also obviously important that we combine the two together. Magnesium, if you we chose malate, which is not specifically a gut magnesium, but we felt that this would give us the most benefit from our magnesium. Maybe just as a caveat, I should mention that I developed this range with a functional dietitian. So I might know that we have to use magnesium, and she would know the best form of magnesium. These supplements are also squeaky clean, no additives, no MSG, even the capsules or veggie capsules, to not cause any additional harm. And then I'm going to just keep on scrolling. Probiotics, no one needs any information on, I'm sure in this room, about the benefits of probiotics, but it's just so much more than just a healthy gut. We have mental well-being, managing weight and metabolism, immune defenses. The multivitamin, we really focus on the B vitamins. Because this is supplemental to one another, we don't necessarily recommend using this multivitamin on its own. We are planning to develop a singular product that has everything added, but at this point, this multivitamin is part of the group. Zinzino is a Swedish company, which I'm just using their product. I just felt like I couldn't improve on something that is so well researched and so well done. So it's omega-3 fatty acids, omega-9. They've got olive oil in there to give us the polyphenols. It's just an amazing, I mean, we all should be on this for brain health, eye health, skin health, heart health. It's just an amazing product. And it helps balance the ratio of the pro-inflammatory omega-6, which can be as high as 1 to 23 if we follow a regular Western diet, to the 1 to 3, which it should be between omega-3 and omega-6 fatty acids. Zinc carnosine is just a very specific blend of zinc and carnosine, which helps to, with all that we have listed, the gut lining, digestive health. So except for Metagenics, we're the only company that brings in Metagenics sells zinc carnosine, but at quite a higher price. Ours, we're probably the only company that brings in the raw material to produce zinc carnosine. And then L-glutamine needs no introduction, but it goes more than just supporting gut integrity. It does have a lot of other benefits as well. I'm going to introduce you to Miss Jolisa. So I only met her when she came to me at 13 months of age. So these are pictures that her mom provided to me. Early infancy, she had severe infantile atopic dermatitis, quite distressing to the family. Multiple pediatricians, multiple dermatologists, really, the typical topical steroid conservative treatment that we always recommend with no great improvement. It doesn't reflect that very well, but when I saw her at age 13 months, she was quite uncomfortable. She couldn't sleep. Her pruritus was just out of control. She was just in a state of discomfort basically all the time. So I did caveat, I didn't just start her on my gut protocol. I put her on an extensively hydrolyzed formula. I made a diagnosis of a dairy and egg allergy. But the results have been absolutely astounding. So 5 weeks after being on this different formula and being on my gut protocol, her skin was clear. I literally was blown away by the results. She had, after 5 weeks, she had 2 areas of excoriation, both hands and both feet, just where she had chafing. And then after 3 months, this is a picture after 3 months, she's been completely clear. Like she's just completely asymptomatic from a eczema perspective. And we're already introducing actual dairy and egg into her diet, not just baked, actual, and she seems to be doing good. I hope I can link. So how to navigate the CureHealth website. Like I said, I've been trying to develop this as a health portal. Okay, so I tell my parents when I see them for the first time that, I'm trying to cram all this information into 30 to 45 to 60 minutes. I tell them they have homework, so I refer them to my website. It's still a work in process. If you see that we have a subset that I'm working on, so the one that's probably the best developed would be these the gut health and metabolic health. So and then I'm further expanding my mom and baby, and then because of my special interest in neurodevelopment, I have been putting all my ADHD and kids and all the kids with autism on this protocol as well, with I think some good results. I've been explaining to the parents, I think it's like an elevator. You start with the tummy and then you go to the brain. So I tell them not to expect results right away. I'm just going to show you how to navigate if you send someone to this website. So we have just a brief explanation of, it's not showing me. There's a way that I can link.
No, that's different.
Close to come up, I'm not sure. Yeah.
All right, welcome back, everyone. We're diving deep today. We're going to be looking at
Are you on your website?
This is my website.
You're not sharing it.
Yeah, it's not sharing the.
Yes,
We are only sharing on presentation. I don't think we're sharing on
No,
screen.
not this way.
Okay.
I'm not sure how
Okay.
to do that.
That's okay. That's okay. I mean, the biggest thing is just for people to recognize they can go on the website. I'm going to go back. So just for the people present here, everything is now linked to YouTube, and everything is evidence-based. So, for example, this gut microbiome and
something that you might not think about every day, which is the connection between our gut microbiome.
So this is just an example of the AI podcast that I'm putting on the website, so that people can just understand, still from a from a research perspective, but also in a layman's understanding perspective, why it is so important that we fix our gut to get to our immunity. So so I'm just gonna. I think I've lost my presentation. It just okay. Okay, but in any case, we can look at the screen. So we have the gut health and immune allergy support that just explains the interplay between gut and immune. And because I always explain to parents is that if you look at immunity and allergy, it's flip sides of the same coin. If we downregulate your immune system, then your allergies are going to improve as well. I've got a very extensive this metabolic health and weight management program. So again, everything's linked to YouTube. I explained the importance of healing the gut and how that interplays with obesity and the microbiome. And then we have lots of evidence-based information on nutrition. We endorse a carb-conscious Mediterranean diet. But I tell people that even if they just eat whole food, something that doesn't come out of a package, then they're already far ahead. We give a lot of medical information about intermittent fasting, stress management, the role of stress in weight gain, and then sleep, how we can reset our sleep cycles and what the effect is on our weight as well, and overall metabolic health. And then maybe not as much of relevance for you guys, but I'm planning on expanding the mom and baby group so that we have a whole preconception care part that people, the prospective moms can access and basically become sort of the healthiest version that they can imagine before becoming pregnant, and then especially during first trimester as well. I'll just briefly mention the association between neurodevelopmental concerns that we're seeing and what I'm passionate about. So the studies show that if a mom has obesity during pregnancy, then her rate of having a child that is on the spectrum, on the autism spectrum, will be twice as high. If she's got gestational diabetes, then her rate is twice as high. If she has both obesity and gestational diabetes, then it's 4 times as high. If a mom has gestational diabetes before 26 weeks completed gestational age, then her risk is like the likelihood is 46% to have a child with autism. These are quite sobering numbers. So I really want to bring awareness that we're not just sitting ducks, that we're not just hoping for the best, but that we really can influence the health of our newborns, and then as they become older as well. And then the school part is just, again, a very comprehensive alternative approach to just getting a Ritalin prescription. We talk about supplements. We talk about type of schooling. We talk about, movement, not just sporting activities, but just kids being physically active, nutrition, sleep, behavioral modification, those type of things. And I'm really still, the sport one is just for later. Any questions?
Thank you so much. This has got a very in-depth presentations, and what's clear that I think we are what we eat actually, and that's actually impact us as an adult, of course, and probably contribute to our death one day in our lives, and also of course the link with chronic disease, something that's always been there. And I'm questioning that any gut problems, it will probably manifest in the skin, So it's basically what you have said, that I think we should be reinforcing what is internally. Internally, when we're pure, I think externally we can actually look great. So my question is, because the product look very natural to me. They're just really kind of supplements that you actually see. And the issue that, of course, there are quite a few studies that come out. I remember the last studies was 3 years ago that come out actually has a review of multivitamins, because we have like a South Africa, we always say South Africa being a nation of vitamins, that they drink a lot of vitamins, as compared to America, which is probably a nation of antidepressant. So the question that is vitamins, supplements, very beneficial in long term in our lives in the age of 60, 70 years, but we have to be a targeted kind of approach.
Yes, so especially the B vitamins, it's quite astounding when you look at B vitamin deficiency. It mimics a lot of the chronic conditions that we see. So that's why we really focused on getting methylated forms of the B vitamins. But the thing is we think that we don't need supplements because we have a varied diet, but we have soil depletion, we have genetically modified foods, A recent study that or just information that I heard is that if you look, I was looking at quercetin, and if you look at genetically modified tomatoes versus organic tomatoes, I think the amount of I stand on a correction if it's I think it's quercetin is 67% less than the GMO variant. So it does seem like our food looks beautiful. You know, we go to Woolworths, we have nothing against Woolworths, I shop there too, but everything looks beautiful. You know, we have nice big juicy fruits and vegetables, but unfortunately, a lot of what we eat is genetically modified. And then, you know, you go to a farmer's market and everything looks a little bit shriveled. There's, you know, there might be some insects around it, and we might be repulsed by it because it doesn't look all that healthy. But the bottom line is that, to come back to your question, it does seem that soil depletion, genetically modifying all our foods, and then disease state. Interesting factor, vitamin C. People with IBD will not absorb their vitamin C. So there are, I think the numbers are 70-80% vitamin C deficient. I will definitely, if you guys are interested in having me again, I'll talk about mast cell activation, which is basically a state of histamine overload. When you have histamine overload, you develop all these food intolerances, and everything is related to just a massive amount of histamine in the body. And that really shapes the way that you eat, because citrus is high in histamine, avos are high in histamine, nuts are high in histamine, aged cheeses will be high in histamine. So these are all fermented foods, kefir, kombucha, all those things are high in histamine. So these are all things that we would tend to recommend ingesting. But for someone that has mast cell or MCAS, won't tolerate it well at all. So the numbers that they're throwing out, they're saying 12% of the population has some form of mast cell activation syndrome. I think it's probably higher. I think it's just not recognized because person A presents with migraine headaches, insomnia, and a little bit of IBS, and person B presents with celiac and depression and rhinitis. We don't link all of these things because, you know, you end up seeing a psychiatrist, your GI specialist, your dermatologist, your ENT specialist, and there's complete breakdown and people recognizing that one single factor causes all these symptoms. So I'm going on a tangent, but the problem is that, and just living with it myself, is that you literally start limiting what you eat. Even something like ketogenic diet, which I love keto, but I've moved away from saying like this is a way of like there should be like the way that you should live, to maybe doing it for 6 months and, you know, just to reset health and then go back to a more diverse diet, because the studies have shown that if you do keto for a long time, there will be restriction to your microbiome, so less diverse population, and then that will result in less beneficial effects to the host as well. So it's all about, I think, balance.
I think that I'm in serious trouble with the keto diet. Well, I love meat. Are we in South Africa, isn't it?
Well, the interesting thing is are you doing carnivore? Are you doing
Carnivore.
So the interesting thing about carnivore is that 50% of your meat still being broken down to glucose. So even though you can look at carnivore as the pinnacle of keto, there's still a lot of breakdown to glucose. So you're not getting that full, if you don't do the 4-to-1, like your 4 parts fat, 2 parts protein, 1 part carb, and you just eat meat, then you're still getting that gluconeogenesis in your liver. So you're still okay.
I've got 2 questions, and it's probably because we don't deal with it a lot. First of all, is breast milk versus formula. Do you see it a lot more in babies or children who's on formula milk? You know, the gut biome and all the complications from it. And the second question that I want to ask is, obesity is quite a big problem, and especially in children as well in the United States. You know, so we use trying to use more Manjaro and all the injectables. Are you using it in children? It's not indicated there.
No, I honestly, I even feel with adults, that's just a personal opinion. I feel that, there's some studies coming out that we're losing a lot of muscle mass with doing the injections. So we're getting a short-term good metabolic result, but long-term we are having fallout with muscle mass. And some of the studies show that more than 50% of people after a year are not using their injections anymore. So my approach is, I'll talk about the breast milk now, and we're definitely seeing obesity in children here also. And we're seeing them in siblings where one sibling is thin and the other one has this visceral fat. So that tells me that it's not necessarily what's happening at home. And the mom will be, health conscious and focused on. So it's not what's, that we're just sharing too many Twinkies and making bad choices. But it does seem like a lot of it is based on this chronic low-grade inflammation cortisol model. So we wouldn't use the injections in kids. So the children I see, because I feel like it's so predictive now. They come into my room, they're obese, they're hypermobile, can't focus. It's in the package. And then, there's a variation in all of them have rhinitis, then they can't sleep, for varying reasons. So it's all related to this. So it seems like a, easy fix, quick fix, get everyone on the protocol. But it is my opinion that by healing the gut, you can help with the fallout for focus, brain fog, weight management, those type of things. So the interesting thing, and that's why I'm so focused on this mother and baby, is that I call it the new epidemic, where to me breast milk is God's way of us feeding our babies. And there's complete epidemic in mommies that's unable to feed their babies because of being allergic to their breast milk. So my theories are, one is that most of us are in some form of a disease state because of the air we breathe, the toxins we're exposed, antibiotics, viruses, the food we eat. So by the time the babies are in utero, then they're exposed to those inflammatory cytokines and mediators. That's the one thing. The second thing is that a lot of us genetically are now predisposed to more food intolerances. So what's happening is we're getting these young babies, 2-3 weeks old, and mom is struggling with baby's colic, reflux, feeding intolerance, and then people give up and then say, let's go to formula with varying results, which is, in my opinion, not the right answer. So what I've been doing is I'm really recommending before pregnancy going on the gut protocol, get everything in order. If you miss that period, then at least the first trimester, because that seems to be where most of the neurodevelopmental influence of maternal inflammation lies. And then if I miss you completely during pregnancy, then I hope to find you during breastfeeding. So then I put the mommies on the protocol, except for quercetin, because that's not been researched in breastfeeding. And then I put the babies on probiotic, DHA, and glutamine with great results. So then I still make some dietary changes to the mama's diet, but then I just, like, these babies just thrive. And then the mummies don't have to be so strict with their diets. And the babies grow out of these symptoms a little bit sooner.
Can I comment? Okay. So there's a lot of literature about HMOs, human milk oligosaccharides, in breast milk, that significantly plays a role in terms of immunity in children and adulthood, which is why it's recommended. And the second thing is the mode of delivery that's important. So babies born vaginally have higher gut diversity in their microbiome as compared to babies born via cesarean section. So basically, if you do want to try to, if you have both, like deliver by Caesar and use formula, then you have increased risk. And then, since I'm talking, can I ask? I was going to comment. We talked about prenatally, which is the most important time for any human being in terms of their health from every organ. But the fathers also play a role in terms of autism, which is also statistically significant, even more than mothers, in terms of fathers who are obese and be significantly high risk of autism. That is a comment. Then on your question, I'm going to expand to say that supplements and probiotics show 17% absorption rate in terms of use as compared to foods. And yes, with global warming, there is a significant decrease in nutritional quality in the food, but they still, the ESAP guidelines say that prebiotics and probiotics don't help with normal gut when you take antibiotics, because it actually can delay the microbiome diversity. So it kills your diversity, but it delays it when you take it in a normal gut. And then in terms of high FODMAP foods, to avoid it with IBS, is something that I just want you to comment on. And then the last thing is my big thing. A 57-year-old lady that presented with typical postmenopausal symptoms, which we know plays a big role. So the effect of estrogen, progesterone, and cortisol on your gut permeability, which we know affects gut microbiome, either decreasing or increasing it. So your obese patients will have a significant effect on your mood symptoms and your vasomotor symptoms, which is what your patient presented. And now the randomized control trial shows a statistically significant outcomes in terms of hormonal effect. If you can just comment.
I'm not that well versed in the hormonal effects, and that's tomorrow's. We definitely working with a functional dietitian. We are definitely going to develop a protocol for postmenopausal females as well, just to affect or address hormonal changes. But it's 100% true what you said about the gut permeability. I just want to echo what you said about the dad's health. It is true. There was a massive Australian study that showed that there was a bigger role, or there was a bigger likelihood for obese dads to have kids on the spectrum than it was for the mommies at the time of conception. So that is really important. The HMOs, I mean, that's why the formulas are now trying to mimic that, which, I mean, which is not a bad idea. I mean, it's like if you have no choice but to formula feed, then having a formula with the HMO is definitely beneficial. If you can tolerate the intact protein, that's the problem. A lot of these babies are having hard time. That's why we have a lot of partially or extensively hydrolyzed formulas that we have to give these babies. And then, sorry, what was the comment? No, but I think you kind of made a comment about the prebiotics. The thing is you talk about
absorption rate on this.
Yes, you talk about a healthy gut. I honestly, it's my opinion that in a westernized, industrialized country like ours, I think 85 to 90% of our guts are compromised. I think if you live, somewhere rural, then you have your own garden and you have vegetables and you have some livestock, then you might be okay. But I think most of us have compromised guts. So
thank you. I think it looks like we all need to own some bit of small farms. Thank you, guys. We have our website. Just